Welcome to the Lippincott Medical Surgical Nursing video series. Today's topic, caring for a patient with diverticulitis. In this module, you'll learn what's involved in caring for a patient with diverticulitis and how to deal with common patient questions and concerns. We'll begin with the report you receive from the nurse who was last on duty. The summary report you'll hear today is in the SBAR method: situation, background, assessment, and recommendations.
All right.
So, you'll be taking care of Chad Browning today?
Yes, I will. What can you tell me about him?
Well, Chad Browning is a 40-year-old patient of Dr. Simmons with no known drug allergies. He was admitted last night with a diagnosis of diverticulitis. He came to the ER last night complaining of pain in his left lower quadrant, which he was rating at the time a 9 out of 10. He reports it started as a nagging pain about 2 days ago, which was about the same time he started to have diarrhea.
Okay.
For vitals, his temperature was 101.5, blood pressure 140/84, pulse 78, and respiratory rate 18. In the ER, they completed a CAT scan of the abdomen and a CBC and Chem7 were drawn. CAT scan showed diverticulitis, no abscesses were noted. White blood cells were elevated at 19.5. His potassium was 3.6.
Okay.
He was given 25 milligrams of mepridine IV for the pain with the first dose at 1 a.m., and he's supposed to continue that every 4 hours for the pain as needed. D5 half-normal saline with 20 milliequivalents of KCl at 100 milliliters an hour was started in an IV through his left hand, and cefazolin 1 gram IV was started with the first dose at 1 a.m. They decided to admit him to the general medical floor at that point, so they sent him up to us. Mr. Browning has a past medical history of diverticulosis. He had a laminectomy of L5S1 10 years ago and says that he has 2 drinks a night and smokes a cigar every weekend. Now for his systems assessment. Neurological. He is awake, alert, and oriented ×3. He is a little anxious at times. Cardiovascular. His heart rate is regular with no adventitious sounds noted, and he has an IV of D5 half-normal saline with 20 of KCl at 100 milliliters an hour going through his left hand. Respiratory, his lungs are clear to auscultation. Gastrointestinal, his abdomen is soft with positive bowel sounds. He does complain of pain in his left lower quadrant. His last dose of mepridine was at 5 a.m. He did have 2 episodes of diarrhea last night, but reports it was much less than before. No blood was noted. Right now, he is NPO and on bed rest with bathroom privileges. Genitourinary. He is voiding clear yellow urine without difficulty. We are measuring INO. Integument. His skin is clean, dry, and intact. Any questions?
When did you say his last dose of mepridine was?
5 a.m., so his next dose can be at 9 this morning.
Okay, got it. What are your recommendations?
I would monitor for any of the warning signs of an acute problem, such as fever greater than 101, nausea, vomiting, loss of bowel sounds, or if his abdomen becomes rigid and board-like. Dr. Simmons would want to know about any of those immediately. I would also check his lab reports this morning, specifically the white blood cell and potassium levels.
Okay, got it.
All right.
Thank you very much.
You got it.
Have a good one.
You too.
Okay.
You're about to watch a registered nurse conduct a focused assessment. This patient has a history of diverticulosis, which has progressed to diverticulitis. Note how she performs each step and, just as important, how she explains what she's doing to help the patient understand what's being done and why.
Good morning, Mr. Browning. I'm Grace Kim, your nurse for today.
Hey.
Hi. I'm just going to get situated here, and then I'm going to wash my hands. Okay, I'm just going to check your ID band, so if you can give me your full name and your date of birth, please.
Chad Browning, August 1st, 1969.
Good. Are you allergic to anything?
Not that I know of.
Okay. So before I start with your vital signs, can you please tell me your level of pain this morning? On a scale from 0 to 10, with 10 being the worst pain imaginable and 0 being no pain at all.
I'd say somewhere around 6. I mean, I can deal with it, but it still really hurts. Hey, is it possible to get my pain medication? I'd really like to have it.
I can give you your next dose in 1 hour.
That long?
Yeah. Let's take a look at your stomach.
At times, it'll be important for you, as the nurse, to alter the planned order of assessments. In this case, the patient's condition indicates doing the GI assessment first.
When I listen to your stomach, I'm going to have to listen under your gown. Is that okay?
Sure.
All right, I'll close the door for privacy. Okay, so I'm just going to bring this down a little bit and lift your gown up. That's good. Okay. I heard some gurgling sounds, and that's good. Now I'm going to touch your stomach, and you tell me if it hurts anywhere. Okay.
Ow. That hurts right there in that lower left part.
Okay. Is this the same area where you had pain earlier?
Yeah, they told me in the ER that I had diverticulitis. I had similar pain about 5 months ago, but it didn't last this long.
Well, that's not unusual. With diverticulosis, which you have, many people experience flare-ups and inflammation. And when that happens, we refer to it as diverticulitis.
Oh, so the itis on the end of the word means inflammation?
Yes, that's right. Now, do you follow a specific diet?
I usually try to follow a high fiber and low residue diet.
That's excellent. Do you generally experience diarrhea or constipation?
Well, lately it's been rough. I've either had diarrhea or constipation. I've tried some laxatives and anti-diarrhea medication, but nothing's really working. The night nurse told me I can't eat or drink anything right now. Why is that?
That's because you have an inflammation in your bowel, and that's what's causing the pain. So right now, the doctor wants you to rest your bowel for a few days. We're giving you IV fluids to keep you hydrated while it's resting. And after some time, when your bowel has rested and the inflammation subsides, we'll start you on clear liquids, and eventually you'll progress back to your high-fiber, low-residue diet.
Okay. Well, the not eating part makes a lot more sense now.
Good. I'm glad. It says here that you had some diarrhea last night.
Twice last night. But it wasn't bad compared to before I came in.
Did you notice any blood?
No, I didn't.
That's good. Well, if you do notice any and you have severe sudden pain, please let me know right away. As soon as I finish my assessment here, I will talk to Dr. Simmons about your current pain levels and your medication schedule.
That would be great.
Okay, so now we'll check your vital signs, starting with your temperature. Open, please. Is that good? .1. Okay, now I'm going to check your blood pressure. The cuff's going to feel a little tight when I squeeze. (128/80).
Is that high? It sounds high.
That's fine. Actually, it's much lower than when you came to the ER. Okay, now I'm going to measure your heart rate. (72). That's fine too. And your respiratory rate is 16. Okay, now I'm going to listen to your heart.
Okay.
When performing a cardiac assessment, listen to the 5 areas of the heart, checking for any abnormal heart sounds. Patients experiencing diarrhea and undergoing electrolyte replacement are at an increased risk for an arrhythmia. Document the heart rate and rhythm, and notify the doctor about any abnormal heart sounds.
When I listen to your heart, I'm going to have to do it under your gown. Is that okay?
That's fine.
Okay. Okay, can you turn to your left side, please? That way I can listen to your PMI, your point of maximum impulse.
All right.
That's good, thank you. Well, Mr. Browning, everything sounds regular, and I didn't hear any unusual sounds.
That's great. That's good to know.
Yes. Now I'd like to listen to your lungs, first from the front and then from the back. If you could take several deep breaths through your mouth, please. Okay, can you lean forward for me? That's good. Just a few more times. Good, thank you. Your lungs sound fine too.
Good.
Okay, now I'm going to check your IV.
When assessing the IV site, check for redness, edema, or drainage. Any of these findings is an indication that the IV site should be changed. Also, assess the IV bag and rate to ensure it matches the current orders.
Tell me, do you feel any pain or discomfort around this area here?
No. No pain there.
Okay, good. I don't see any redness or swelling. It checks out just fine. Now, if you do feel pain or discomfort, let me know right away and I'll have the IV site changed.
I can do that.
Okay. Now I'm going to check your IV bag and rate. D5 half normal saline with 20 of KCl at 100 milliliters an hour, 100 milliliters an hour. Everything looks good.
Great.
Okay, I'm gonna call the doctor and let him know about your pain level and medications. If there's anything you need in the meantime, please let me know. Can you reach your call button okay?
Yeah, I can.
Okay, good. I'll be back as soon as I'm done.
You will return all of the equipment and promote good infection control practice by washing your hands.
Thank you.
Thank you.
Could you remember my pain meds?
Yes.
When compiling your report, keep in mind that by noting trends from one assessment to the next, you can provide helpful insights for the patient's care. Based on your assessment, your nursing diagnoses for Mr. Browning may include alteration in normal pattern of elimination, anxiety related to knowledge deficit of disease process and treatment, and acute pain related to inflammation and infection. Thank you for watching this video on caring for a patient with diverticulitis. Be sure to also study the instructions in your textbook, and please review this presentation at any time to support your learning and patient care.